Welcome to Mercy Unbound. My name is Dr. Brian Thatcher, and this is a series that aims to provide hope, an avenue for healing, and one that will help you better understand and then live the great mercy of God. In today's show, I'll be speaking with Dr. Mariana Giron, a medical doctor here in Tampa. On her practice, it's called Life Choices Medical, and the website is lifechoicesmedical.com. So easy to remember. We're going to discuss briefly her medical practice and philosophy of holistic medical care for the entire family, as well as topics of birth control and fertility and infertility issues using the NAPRO technology. We'll talk about that. We're going to talk about the abortion pill RU486 and misoprostol, Cytotec, I knew it as, and their reversal of the abortion, their abortifacients, and we'll be talking about the success rates with that. These topics are all so relevant today in an age when the sanctity of life is being eroded and challenged. So welcome, Dr. Giron, to Mercy Unbound.
Thank you
I guess
for giving me the honor to be here.
Just to get us started, on your website, you list holistic medical care for the whole entire family. Share with us what really holistic medicine is and what do you mean by that phrase? And does that also include a spiritual component in your care?
Yeah, so holistic medical care involves addressing all aspects of health, all the factors that affect a person's health. So we're talking about physical factors, mental, spiritual, of course, emotional. And so we know that all these factors are really determine a person's well-being. And so for us at Life Choices, the spiritual aspect is incredibly important in how we provide care and how we approach our patients, because our faith is what informs what we do, and really what we're trying to do at Life Choices is to transmit God's love and mercy to our patients through the medical care that we provide. And so just to give you a few examples of what we mean by holistic care, in traditional medical practices, you go in to get your blood pressure controlled, and you go in, if it's uncontrolled, you get your medication adjusted, or and get a new prescription, and then you're done. Because unfortunately, in primary care in our country, it's often 15-minute visits, 10 to 15-minute visits. Doctors are seeing 15 patients per half day, and really that's all you have time to do. So fortunately, at our clinic, we are a nonprofit, and so we're not driven by how many patients we can see for half day. I'm able to spend extra time with my patients, addressing other factors that may be contributing to their illness. So going back to the hypertension, high blood pressure patient, if I have a patient who comes in with uncontrolled blood pressure, I need to make sure that I address what else could be going on. So for example, I'll be asking about how they're feeling, about, are they suffering from depression, and is that why they're not taking their medication, or are they unable to afford their medication, or, and so just being able to dig into what is going on in their world and not just what's going on with their body. That's really how we approach our patients in our clinic. And so, just to give you another example, we have a lot of our patients choose us because they're Catholic, and they want to make sure that they go to a practice that, that honors their Catholic Christian faith. And so we have, quite a few patients. I see kids, adults, the whole family. But I do have certain patients that are very concerned about, what vaccines are going into their kids' bodies. They want to make sure that they make a decision that their conscience, that doesn't violate their conscience. And so I'm talking about, vaccines that are derived from aborted fetal cell lines. And so, we're able to address that part of their of their health. And so at our practice, we have the vaccines that are not derived from aborted fetal tissue, unless, there are no alternatives. For example, the MMR vaccine, hepatitis A, all those. Unfortunately, the United States, there are no alternatives. So we do have to use those, but that's something that I've had several conversations with different parents who are asking for, we're Catholic and we're Christian, and we want to make sure that we make the right decision for a baby. So that's another example.
A couple thoughts come to my mind while you were speaking, and one is, even in my own practice many years ago, I went to medical school, then my residency, pre-med, then my fellowship, and you got all these years of training, and you're learning all these esoteric rare diseases as a specialist, and yet 80% of the time, the people that came to my GI practice were really stress-related symptoms, and it's just unreal. And of course, now we've got COVID. We don't even imagine what's going on behind the scenes with their loved ones may be dying alone in a nursing home.
That's awful.
You talk about blood pressure. Well, all these things in kids and teenagers and the way society's going, so many other things going on behind the scenes that really, I think people go into a doctor's office, and honestly, most physicians don't have time, like you said, to address the whole picture.
Right.
And
Yeah.
I think in hindsight, if I had to do it over, I'd probably try to listen more to my patients. And the old saying, you got 2 ears and 1 mouth, but just listen to the patients.
Yes, absolutely. I mean, most of the time, if you listen long enough, the patient will give you the answer to what is going on with them. And so we have the opportunity to do that at our clinic, and it's been an immense blessing. And to tell you the truth, it is so rewarding for me to be able to sit with a patient and talk about what's going on in their life, and be able to address what their concerns are, not just what's on my agenda for them. And it just leads to a much more rewarding practice than seeing patient after patient for 10 minutes and just refilling medications.
Yeah.
And so it's definitely, it's an incredible blessing for me to be able to do that.
It's got to be more fulfilling, as you said. And, one of my favorite role model doctors is Dr. Giuseppe Moscati from Italy. And he's a saint, and he was just a wonderful, they used to call him, now imagine him calling this to you or me, and said, oh, that's the holy doctor in Tampa. But he was called the holy doctor of Naples, Italy. And he was so good to his
Wow.
patients, and always reaching out, and always, like, if they had an outbreak of cholera, he was the first one at the nursing home to help get the patients out. And he just lived a life of mercy. And I remember his miracle that led to his canonization. There was a young man who had leukemia, and he was near death, and he ended up making a miraculous recovery. But his mother had a dream, and she saw this doctor in a white coat that she never recognized. And it was much later, someone said, oh, that's Dr. Moscati. And he had appeared at the bedside, and through his intercession, the Lord healed the kid. But yeah, just the holy doctor of Naples. What a title.
That's beautiful.
The this whole thing of birth control, contraception, abortion is to me a fundamental issue in our society today, in the sanctity of life. The church has a method approves of the NAPRO technology, kind of watching the female's hormones levels. And then I'm going to let you talk about it. I was a GI doctor, not an OB-GYN, but could you talk to us about what that is and how that works?
Yeah, no, it's something I'm very passionate about. So basically, what we're talking about here is fertility awareness-based methods. Just to clarify, it is not the rhythm method. It started out as a rhythm method back in the, early 50s, 60s. And back then, there wasn't a lot of research behind, how to tell when a woman is fertile. And so the written method was sort of like you know, one analogy that's used frequently is it's like the telephone, the rotary phone, and now we have iPhones, and so that's sort of the progression that we've seen with fertility awareness-based methods. And so nowadays we have decades of research, sort of detailing what happens during the woman's cycle and how we're able to identify the fertile period. And so just to briefly explain, the first part of the woman's cycle is, usually between 28 to 32 days. So day one is the first day of the woman's menstrual cycle. So during the first half of the cycle, we see a rise in estrogen. And so around ovulation time, that's when estrogen gets to its peak. And at that point, progesterone takes over right after ovulation. And so the woman still produces estrogen, but after ovulation, it's progesterone that is a hormone that takes over. And, if the woman gets pregnant at ovulation, then, progesterone is that keeps the pregnancy going until the placenta takes over and then produces more progesterone. And so what's so interesting is that the woman shows signs of fertility around ovulation time due to these hormonal changes. And so around ovulation time, the woman will start to notice that the cervical fluid will be different. Different in quality, different in quantity, and that's an action of estrogen increasing. And so estrogen acts in the cells of the cervix to produce a different type of cervical mucus. And so the woman is able to identify that period around ovulation on when to get pregnant, because a woman cannot get pregnant every day of the month. Like, she can only get pregnant about 1 week out of the month. And so women learn through a method that they choose to identify that. So there are different methods out there. The cervical mucus methods that I just described are the Billings method and then the Creighton model, which is based on Billings. But then the other thing that women can look out for is our temperature. And so the rising progesterone around ovulation time will lead to an increase in basal body temperature. And so that's another sign, bodily sign, that the woman can use to identify that fertile period.
Now, if she's looking at her secretions,
Yes.
and if I remember,
Yep.
thin and more mucus, how would you describe them?
So the best description is for the fertile type of mucus is sort of like egg white, like an egg white consistency. It's like very stretchy, clear. It has like a sensation of like a lubricative sensation. And so that when the woman sees that, she knows she's close to ovulating. And if she's trying to avoid pregnancy, then the couple will decide to not have intercourse nor have sex during those days. But the most important thing is
more elastic type during the ovulation period time.
Exactly. And so, but the most important thing is the woman, the couple needs to be taught by an instructor on how to identify, how to chart their cycle. Because if you try to read it, if you try to learn from a book or from a website, it's not going to be as effective. You really need to have somebody that sort of coaches you, gives you an introduction and coaches you, because every woman is different. Every woman's cycle looks different, and so that woman needs coaching to be able to use the method correctly. And so that's very important.
I know in our diocese, I'm almost sure we have trained people that will help for those looking to learn more about it in the Diocese of St. Petersburg, which is, like you said, is critical, because there are charts and everything. I would assume you have to chart. And
yeah, exactly. So the woman, the couple, because ideally it's done as a team. They will be charting their observations on a chart, and then they can use the chart to guide their decisions on what their family planning needs are. But it's beautiful, and not only is it very helpful for family planning, but it's very empowering for women to have this knowledge about their body. I mean, so many women out there have no idea that they can only get pregnant for a few days out of the month, but they have no idea that they can, you know, take control over what over their bodies. I mean, knowledge is power. And unfortunately, this is something that, I think only about 6% of physicians know anything about these methods. There are so many misconceptions out there about what these methods are. As a medical student, the only training I got with my classmates was one slide in medical school during the reproductive block, and it was basically saying, oh, these methods don't work and you should not offer these to your patients. And so it's a shame, because there's so much more out there that patients are missing out on, that people are missing out on.
You're not putting medications in the body. You're not altering anything. You're just using the normal body function to determine ovulation.
That's exactly right.
How successful is it?
So if you're taught by an instructor, you can see effectiveness rates up to 95 to 99%. And so, you will see some studies out there that say, oh, they're only 80% effective. Well, that's because these studies have only looked at, they call people at home, as part of a survey, as part of a study, and then if they say anything other than, oh, we're using artificial birth control, they count it as natural family planning. And so the studies that are out there published on, PubMed, are not really examining each method, because as I was describing, there are different methods of NFP, of natural family planning, and they all have different effectiveness rates. But you can't combine them with the rhythm method, which is what these big studies have done. But we have seen in other studies where you see the different methods spelled out, we've seen that they can be 95 to 99% effective, which is it's comparable to artificial birth control. And so
one thing you alluded to was, this is a team effort. And I think it does in some ways can bring the couples closer together, because there's some sacrifice on both sides here. If it's ovulation time, the man can't just expect something to happen when he knows what the outcome's going to be. And so in a way that can be a beautiful thing too, in the strengthening of the marriage.
Oh, absolutely. And we have seen that. It forces couples to communicate. They have to talk about, they have to continually reassess what their, family planning needs are, whether or not they want another baby. And it really does facilitate that communication, and that, it's a team effort. And then it's great too, because, the many times in some couples, you see that they show love only in physical ways, but there's so many other ways of showing love for each other that don't involve the physical aspect. And you're really, as a couple, you are not forced to, but you're encouraged to, if you have serious reasons to avoid pregnancy, it's those times during ovulation, during those fertile periods, that you are encouraged to use those other ways of showing love to one another, and that can only serve to strengthen marriages.
Another point you touched on, which I'd like to develop a little bit, is this concept. You use it for planning, but so many couples out there may be having trouble with infertility, and they're spending thousands and thousands and thousands of dollars getting bankrupt because they want to so badly have a child, and they don't even understand their own physiology of the woman and the hormones. How can infertility be used in this method?
And that's another wonderful aspect about these methods. So as you can imagine, knowing when ovulation happens is incredibly important in the investigation of infertility. And so, using the woman's chart, we're able to identify gynecologic disorders that could be contributing to infertility, because that's the main goal with NAPR technology, is to get to the cause of the problem, not to put a band-aid on it and say, here's, do in vitro fertilization. No, we want to get at the root of the cause of the diagnosis. And so different patterns of bleeding and different patterns of cervical mucus can indicate or can give us a clue about what could be going on with infertility. But knowing when ovulation happens also allows us to do targeted hormone testing. As I was explaining earlier, your levels of estrogen and progesterone fluctuate throughout the month. And if the woman doesn't know where in her cycle she is, if she has no idea when she ovulated, then it's basically impossible to be able to interpret that estrogen level or that progesterone level, because the normal levels will just depend on what day of the cycle she's on. So what we're able to do with this system is, by knowing exactly when ovulation happened, we can check the hormones a few days before ovulation and a few days after ovulation, and we're able to compare those levels to women with normal fertility. And if there is a deficiency in progesterone or estrogen, we're able to identify it, and we're able to do something about it. We're able to supplement using natural hormones when there is a deficiency. And that's something that you can really only do when you have your chart in front of you, and when you know when you ovulated, because many times the deficiency could be present prior to ovulation, is the or after ovulation. And so you just got to know when that deficiency is happening. So very powerful and a lot less costly than IVF. And the beauty of it is that we're able to identify in many cases what is going on with the patient, what is causing her infertility. We see fertility as the fifth vital sign, right? It's not, like if a woman has an issue with fertility, it means that there's something wrong with her body that we need to investigate. We treat fertility as a sign of health and not as a disease, which is why we don't recommend contraceptives or sterilization. Like, fertility is not a disease, it's a sign of health.
When you're saying that about a sign of health and not disease, I'm reminded of Mother Teresa's comment years ago at a prayer breakfast that America looks on children as a nuisance, a bother, a burden. And that takes us into the next couple of questions I'd like to chat with you about today, Dr. Mariana, and that's about the issue of abortion.
Yeah.
The morning after pill, RU486, is a commonly used form of contraception, primarily, I believe, in Europe. Years ago, when I was a GI doctor, I remember when this drug called Cytotec came out, misoprostol, and it was an ulcer medication. But you couldn't give it to younger women because one of the side effects was, we didn't realize how bad it was, but it was that it was an abortifacient. Yeah. And a real problem. I always wondered, even then, back years ago, if medicine's going to flip that around and the drug company will say, oh, look here, we can use this drug, which was an ulcer med, for something, and use it to our advantage. How do these drugs work when you're talking about estrogen and progesterone, and how do these drugs work?
Yeah, so I just want to make a distinction between the morning after pill and the abortion pill. So I will talk about the morning after pill first. And so another name for the morning after pill is Plan B. I'm sure many of our listeners have heard that term. And it's a medication that is marketed as, it's a form of birth control that you can take after you've had unprotected intercourse, that will protect you from getting pregnant. And so what that medication primarily does is it delays, so it's a progesterone, it's a an artificial progesterone that basically delays ovulation. And so that's the primary mechanism of action. However, if ovulation and fertilization have already occurred, then the medication, the Plan B or morning after pill, will prevent implantation of the embryo in the uterine lining, therefore causing an abortion. And so unfortunately, this is something that patients, that the public isn't told about. And there's a little secret that I want to share with our listeners. And it's that a few decades ago, the American College of Obstetrics and Gynecologists and the OB community, obstetrics community, changed the definition of pregnancy. So before, pregnancy used to be defined as, life starts after conception. That's the definition of pregnancy. But a few years ago, it was redefined as pregnancy means a fertilized embryo that has already implanted. That's what a pregnancy is. So as you can see, if you can tell your patients that, oh, the morning after pill does not interfere with your pregnancy, if you're already pregnant, it's not going to cause you to have an abortion because you're not pregnant yet. But what that means is, well, the embryo has not implanted yet, therefore we're not calling that a pregnancy. But many people want to know that, hey, if I have a patient that believes that life starts after conception, they will want to know that. And so I remember when I was in medical school, we had a lecture about this, and I remember asking the attending, like, hey, are we supposed to tell our patients that these medications could potentially act as abortive fashions? And she was a little upset, and she said, well, no, we don't want to confuse patients. We should not tell them that because we define pregnancy as an implanted embryo. But the secret is, well, that's a redefinition of pregnancy.
Right, just to satisfy the drugs.
Yeah, so Plan B markets themselves as, this delays ovulation, it doesn't cause an abortion, but we know that it can also act to prevent implantation of the fertilized egg or the embryo. So that's the morning after pill. Now the abortion pill, sort of a misnomer because it consists of two pills, and this is what what is used in the United States for the medical abortion. So the first pill is the mifepristone. And what that does is it blocks progesterone.
The receptors.
From keeping the pregnancy. Mm-hmm. And so as I was saying before, progesterone is a hormone that keeps the pregnancy, that sort of makes sure that the lining of the uterus is it's formed and that it's holding the baby, it's holding the pregnancy, the embryo. And so if you block the action of progesterone, then the lining of the uterus will shed and the baby will go with it. And so that's the first pill that patients get, and they usually get that in the clinic, in the abortion clinic. And so the second pill that they take is the cytotec or misoprostol. And what misoprostol does is it causes uterine contractions, and that's used to basically expel the embryo. So both pills act together to complete the medical abortion.
Now, you talked about the morning after pill, and I really didn't know how its mechanism was, but can you reverse the morning after pill?
So great question. So you can reverse the abortion pill. So as I described, the abortion pill has two different components. The first one is the mifepristone. The second one is the cytotec or misoprostol. So if a woman changes her mind, if a woman, wants to have an abortion, but she changes her mind halfway through the process, there is a way to try to reverse the decision to have the abortion. And so if the woman has only taken the first pill, the mifepristone, we are able through the abortion pill reversal protocol to flood her body with natural progesterone so that it counteracts the action of the mifepristone, which, as I said before, blocks progesterone from acting. But if you flood the system with progesterone, then the progesterone will, will take over, and the baby can be saved.
So you're hoping to flood the receptors and
Exactly.
effect of the
That's
now,
exactly right. And so there is a hotline. If any woman Google's abortion reversal, the abortion reversal protocol will come up, and there is a hotline, and their provider, and our clinic is one of the providers.
okay.
They're connected with a clinic in their city, and they're able to discuss with a provider, and the provider can electronically prescribe the progesterone, so that the woman can attempt to save her baby if she changes her mind. Unfortunately, it doesn't work after the second pill. So if they've already taken the second pill, it's too late. But it can definitely be effective after taking the first pill.
They have to just have taken the first pill. Now, I'm sure there's a time element here as well. When it's not effective anymore. What's the time frame we're talking, and then what's the overall percentage if you decide to? And these intramuscular shots of progesterone?
Oral, they're pills.
Really? Okay.
So they can take pills. Yeah. So, the earlier the better. And so we're talking about, 24 to 48 hours. But the earlier that the woman changes her mind, the better, because the progesterone can take over and get on those receptors and win the battle against the mifepristone. And we've seen in small studies that it's about 60% effective. And if you were to not give the progesterone, if, let's say, the woman changes her mind and doesn't take the second pill, but doesn't contact the abortion pill reversal protocol providers, there is about in the study, it's hard to study these things, but it's about 15 to 40% the chance of saving the baby without taking the progesterone. So we have seen that the chance of saving the baby does increase with the abortion pill reversal protocol.
Okay.
And so we've had some cases in our clinic, some patients from our clinic who have gone through the protocol, and we met their babies.
Awesome.
So it's a beautiful. It's definitely it's something that everyone should know about, because the woman, if she made the decision to have an abortion, well, she should also have the right to make the decision to reverse it, and everyone should know that this is available.
Just to help me out understand this a little more, the morning after pill, there's no reversal for that?
So usually not, because once you take the Plan B or the artificial progesterone, that again, most of the time it'll act to delay ovulation. But if fertilization already happened, then usually the lining of the uterus will disintegrate after they take the pill.
And just getting back to one other point you mentioned on the infertility issue, for all the people watching this, this is something they want to look into, of the NAPRO technology and understanding your own body, to find these things out, and because it can be effective tool for infertility, as well as
definitely
fertility, I should say. So
yes,
Dr. Giron,
absolutely.
any other thoughts you would like to share with the audience today on practice, what you've seen, anything you just want to leave as a last closing thought with the viewers today?
Yeah, so I just want to encourage our listeners to to discuss these things with their doctors. Like, I think one of the issues with the medical community is that, as I was saying earlier, doctors don't know about these different options for family planning. And I think that the more that patients ask about these methods, the more that physicians or healthcare providers out there will be interested in learning about them, because this is really, I mean, it's the missing piece in women's health. And so there's so much to offer from NAPR technology and from the fertility awareness-based methods, that I just makes me sad to know that there's so many people, so many women out there missing out on this. And so ask your providers, and if your provider is not familiar with with Creighton or with any of the fertility awareness-based methods or with NAPR technology, in many parishes, the priests know people, and so talk to your priest, reach out to the diocese, and so there are Catholic clinics out there providing this type of care, and you just gotta find them, but they're all over the place, and we're all trying to expand access to this type of healthcare. So wherever you are, ask around in your circles, because everyone deserves to have this type of care.
Well, I want to thank you today for joining me on Mercy Unbound. And for those listening via podcast at anchor.fm/Dr. Brian Thatcher, you can watch the full video at drbrianthatcher.com. I just want to encourage you, Dr. Giron. Sometimes we feel like we're swimming upstream, standing up for the truth, but the world's in a state of darkness right now, and darkness cannot drive out darkness, only light can, and hate cannot drive out hate, only love can. People know that contact Dr. Giron at lifechoicesmedical.com. Look her up on the web. She's got a beautiful attitude, spirituality of trying to be the merciful Jesus to her patients. And I personally would love to speak at your conference or church on the Blessed Mother, the Eucharist, the gift of life. And support us if you can, and join us for next week's show on Mercy Unbound. And God bless all of you. Please subscribe to our YouTube channel for the video portion. The podcast can be heard at anchor.fm/Dr. Brian, Brian Thatcher, Thatcher, and on all the major podcast forums. I would love to speak at your church or conference, and please consider supporting our efforts to spread the truth to a hurting world. Thank you again. And for more information, go to the website at drbrianthatcher.com.